The human body is an intricate and fascinating machine, a complex interplay of systems working in harmony. And for men, nestled within this incredible design, the prostate gland plays a small but undeniably vital role. It's a key component of the male reproductive system, often overlooked but essential for healthy function. Roughly about the size of a walnut, it's a compact organ with a significant job. It sits strategically just below the bladder, acting as a gatekeeper, and directly in front of the rectum, a location that makes it susceptible to certain examinations. This positioning is crucial to its function and also to understanding potential health issues. So what exactly is its main job? What critical function does this small gland perform? Its primary responsibility is producing a special fluid, a milky secretion that nourishes and protects sperm cells, providing them with the energy and environment they need to survive. This fluid is a key part of reproduction, contributing significantly to male fertility and the ability to conceive. Without it, sperm would struggle to reach their destination. During ejaculation, the prostate contracts, squeezing this vital fluid into the urethra, the tube that carries both urine and semen out of the body. There, it mixes with sperm produced in the testicles, creating semen, the fluid that is ejaculated during sexual activity. This mixture is essential for successful fertilization. However, as men age, the prostate gland doesn't always stay the same size. In many cases, it can gradually grow larger. This is a very common condition called benign prostatic hyperplasia, or BPH for short. It's a natural part of the aging process for many men. It's important to remember that BPH isn't cancer, and it doesn't increase your risk of developing prostate cancer. But even though it's not cancerous, BPH can still cause bothersome symptoms, such as a frequent urge to urinate, especially at night. You might also experience difficulty starting urination, a weak urine stream, or dribbling after you've finished. The reason for these urinary symptoms is because the prostate gland surrounds the urethra, the tube that carries urine from the bladder. Therefore, any change in the prostate size, particularly enlargement, can put pressure on the urethra and affect the normal flow of urine. That's why monitoring these changes and paying attention to any new or worsening urinary symptoms is crucial. Early detection and management can significantly improve your comfort and overall health as you get older, allowing you to maintain a good quality of life. Think of your prostate like the engine in your car. It's a vital component that needs to be in good working order. You don't always see it or think about it, but you need it running smoothly to avoid problems down the road. Learning about your prostate, understanding its function, and recognizing potential issues is the first and most important step. It empowers you to take control of your health and make informed decisions about your well-being. Be observant of any changes in your urinary habits or any discomfort you might be experiencing. And don't hesitate to seek advice from your doctor or a qualified healthcare professional if you have any concerns. Remember, knowledge is your best tool for staying healthy and maintaining a good quality of life as you age. Prostate cancer happens when cells in the prostate gland, a small gland located below the bladder in men, begin to grow out of control. It's a complex process, and understanding it is the first step in taking charge of your health. These cells, unlike normal cells, divide and multiply rapidly, ignoring the body's natural signals to stop. This uncontrolled growth is what sets prostate cancer apart from benign conditions. As these cancerous cells proliferate, they can start forming a tumor, a mass of abnormal tissue within the prostate. The size and location of the tumor can vary, and it may not always cause noticeable symptoms in the early stages. This is why regular screenings and checkups are so important, as they can help detect tumors before they become more advanced. If left unchecked and untreated, these cancerous cells can invade nearby tissues, extending beyond the prostate gland itself. This local invasion can affect surrounding organs and structures, leading to more significant health problems. The ability of cancer cells to invade is a critical factor in determining the severity and treatment options for prostate cancer. In more advanced cases, the cancer can spread to other parts of the body, a process known as metastasis. This occurs when cancer cells break away from the original tumor and travel through the bloodstream or lymphatic system to distant organs and tissues. Common sites for prostate cancer metastasis include the bones, lymph nodes, lungs, and liver. This process is called metastasis, and it's a significant concern because it makes the cancer more difficult to treat. Once cancer has metastasized, it's considered to be in a more advanced stage, requiring more aggressive and comprehensive treatment strategies. Understanding metastasis is crucial for developing effective therapies and improving patient outcomes. The risk of prostate cancer rises with age, especially after 40, as the prostate gland naturally undergoes changes over time. These age-related changes can increase the likelihood of abnormal cell growth and the development of cancer. While prostate cancer can occur in younger men, it's far more common in older age groups. In fact, most cases are found in men over 65, highlighting the importance of regular screenings and checkups for this age group. As men age, their risk of developing prostate cancer increases significantly, making early detection and intervention even more critical. It's one of the most common cancers in men, affecting a significant portion of the male population worldwide. This widespread prevalence underscores the need for increased awareness, education, and research efforts to combat prostate cancer effectively. The good news is that early detection makes it highly treatable, with a high success rate when the cancer is caught in its early stages. Advances in medical technology and treatment options have significantly improved the prognosis for men diagnosed with prostate cancer, especially when detected early. Many prostate cancers grow slowly and may never cause harm, remaining localized and not requiring aggressive treatment. In some cases, these slow-growing cancers may be monitored through active surveillance, where doctors closely track the cancer's progress without immediate intervention. However, it's important to remember that some prostate cancers are aggressive, growing and spreading rapidly. These aggressive cancers require prompt and aggressive treatment to prevent them from causing serious health complications. The key is catching it early, through regular screenings and checkups with your doctor. Early detection allows for a wider range of treatment options and a better chance of successful outcomes. This is before it spreads to other parts of the body, making treatment more challenging. Preventing the spread of cancer is a primary goal of early detection and intervention strategies. Regular checkups, including prostate-specific antigen, PSA tests, and digital rectal exams, DRE, and honest conversations with your doctor about your risk factors and screening options are essential for maintaining your health. Open communication with your healthcare provider is crucial for making informed decisions about your prostate health. Think of it like a warning light on your car's dashboard. It's there to alert you to potential problems that need attention. You wouldn't ignore it, hoping it will go away on its own. Ignoring a warning light can lead to more serious and costly repairs down the road. Understanding your risk factors, like age, which is a primary determinant, and family history, as having a father or brother with prostate cancer increases your risk, helps you make smart choices about screening, including when to start and which tests are right for you. Informed decision-making is a cornerstone of proactive healthcare. Being proactive, not reactive, about your health is essential. It puts you in control of your health journey and empowers you to make informed decisions. Don't let fear or anxiety keep you from learning about prostate cancer and taking the necessary steps to protect your health. Awareness and action are your best defense against prostate cancer. Stay informed about the latest research and guidelines, and you'll be ready to protect your health and well-being. Your body is constantly communicating with you, sending signals that indicate whether everything is functioning as it should. It's a complex system, and when something goes wrong, your body often sends out warning signs. Learn to listen to these signals. Pay close attention to what your body is telling you. Early detection is key when it comes to health issues, especially concerning the prostate. Early prostate issues often show up as urinary changes. These are frequently the first indicators that something might not be quite right. This can manifest as needing to go more often than usual, especially at night, disrupting your sleep and overall well-being. This is a common symptom and shouldn't be ignored. Another sign is having a weak or interrupted urine stream. The flow might start and stop, or it might feel like you're not emptying your bladder completely. Difficulty starting urination can also be a telltale sign. You might feel the urge to go, but struggle to initiate the flow. The sensation of feeling like your bladder isn't completely empty after urinating can also be a sign of prostate issues. This can lead to discomfort and a frequent urge to return to the bathroom. Experiencing pain or a burning sensation when urinating shouldn't be ignored. This could indicate an infection or other underlying problem that requires medical attention. The presence of blood in your urine, even a small amount, is a cause for concern. Similarly, blood in your semen is a red flag. It's crucial to seek medical advice promptly. If you notice blood in either your urine or semen, see a doctor right away for a thorough evaluation. Persistent pain in your lower back, that doesn't subside with rest or over-the-counter pain relievers warrants investigation. Pain in your hips or pelvis could mean the cancer has spread beyond the prostate. Painful ejaculation is another symptom to watch for, as it can indicate inflammation or other issues within the prostate or surrounding tissues. It's important to remember that while these issues can be caused by non-cancerous conditions, such as an enlarged prostate or infection, it's always best to err on the side of caution. Don't dismiss them or assume they're nothing serious. Remember, early prostate cancer may cause no noticeable symptoms at all. This is why screening and awareness are so important. That's precisely why regular monitoring and checkups with your doctor matter so much. They can help detect potential problems early, even before symptoms appear. Pay close attention to any changes you notice in your body, no matter how small or insignificant they may seem at first. Listening to your body is a skill that develops over time. It requires being present and attuned to your physical sensations. Practice it regularly, making it a part of your self-care routine. And most importantly, take action and consult with a healthcare professional if something feels off or unusual. You can't do a prostate self-exam, but you can check in with your body. Notice changes in how often you urinate, especially at night. Pay attention to the strength and flow of your urine. Weak or interrupted streams matter. Look for blood in your urine or semen. Even a hint should prompt a doctor's visit. Tune in to new persistent aches in your lower back, hips, or pelvis. By knowing what's normal for you, you'll spot changes early. Self-awareness is your first line of defense. Some symptoms mean you should see a doctor right away. Blood in your urine or semen is never normal. Don't wait to get it checked. Sudden, persistent changes in urination, especially with pain, need prompt attention. Constant feeling of not emptying your bladder or burning with urination are also urgent signs. Deep, unexplained pain in your lower back, hips, or pelvis could signal cancer has spread. Don't dismiss persistent bone pain as just aging. If symptoms worry you, even if they seem minor, talk to your doctor. Early action can make all the difference. While you can't guarantee prevention, healthy habits lower your risk. Eat more fruits, vegetables, and foods rich in lycopene, like tomatoes and watermelon. Choose fish with omega-3s, such as salmon and tuna. Stay active. Aim for at least 30 minutes of moderate exercise most days. Maintain a healthy weight. Excess fat, especially around your waist, increases risk. Small changes like taking the stairs or drinking water instead of soda add up. Manage stress and get enough sleep. Both support your immune system. These habits work together to protect your prostate and overall health. Start with one change and build from there. Your future self will thank you. The most important step? Talk to your doctor. Don't let embarrassment stop you. Your health comes first. Starting at age 50 or earlier if you have risk factors, discuss screening options. Your doctor may suggest a PSA blood test or a digital rectal exam. This is a partnership. Share your concerns, symptoms, and family history. Ask questions and weigh the pros and cons of screening together. Write down your questions before your appointment. Think of this as a strategy session for your long-term health. Being proactive puts you in control. Don't wait. Start the conversation today.